Good afternoon, everyone, and welcome to our first PHS Virtual Journal Club. This initiative began as a way to obtain CPD points for our clinical team, but thought it would be a great idea to invite all our colleagues across our client profile and beyond so that we can share in the growth and the development. We will be having a series of these webinars, each focusing on different journal articles that aim to increase our clinical expertise within the practice of therapy. All these webinars have been accredited for CPD points, which is a mighty appreciative thank you to our employer. So for those that will be attending these sessions, they will be able to obtain a CPD point per full attendance of a session. My name is Mudiege Bopape, and I will be the moderator for the session. Ms. Liesel Anthony will be our presenter for the session, and she will be unpacking the topic, Cultivating Online Therapeutic Presence. With COVID-19, we all had to step into the reality of working digitally. While some found it very easy, for some, it was such a challenge, such as the BBTs, born before technology. In this session, we will be learning more about how we can overcome this challenge. Now, Ms. Anthony is a clinical psychologist and is currently the EAP operations manager at PHS. She has extensive experience within the field of EAP, having worked in both government and the corporate sector, including running a private practice. Liesel, we look forward to learning from you. Now, before I jump into the session, I would like for us to go through a few of our house rules. Firstly, please note that in order to qualify for a CPD point, you will need to stay logged in the session for at least 90% of the time, but don't just log on. Focus and listen into the session to fully benefit from the time spent with us. Secondly, to ensure that you do get your CPD points from the session, please leave your details in the chat section. And in the details, please include your name, your surname, professional body registration number, and your email address. So leave these details in the chat section. Lastly, we will have our Q&A session at the end of the session, at the end of the presentation. So if you have questions, and please do post up your questions, please post these in the Q&A function. Alternatively, you can raise your hand at the end of towards the end of the session to ask your question. Once again, welcome everyone to our first virtual journal club, and thank you for joining us. Now, without any further ado, I present to you all Ms. Liesel Anthony.
Thank you so much, Modiege. Thanks for the lovely introduction. And yes, like you said, this is the very first of our series of webinars where anybody, in the EAP field, all our client companies and the EAP wellness advisors internally can actually earn CPD points for free. So we have 7 more lined up for the rest of the year, 8 including today's one, and we're looking forward to spending time with you. So basically, we're going to look at different journal articles that might be relevant to our work and what we're doing. And we hope to engage with you, to network with you, and to share best practice, and to just talk in general about, some of the challenges and also some of the good things that we are experiencing. So welcome to everybody that is here. We're hoping that more people will start to log on. And I will just get my presentation ready. So as we've stated, today we'll really be looking at cultivating online therapeutic presence. So how do we do that? And especially, we've been challenged at the start of COVID-19 when the pandemic hit us in March last year. And we all had to start to learn new ways of coping, new ways of dealing with our clients, be able to see them, be able to provide the service. And this research article was published in June 2020. And we know that a range of different topics have been researched relating to COVID-19 and how especially mental health professionals have been challenged by it. So we were looking at how do we strengthen the therapeutic relationships in teletherapy sessions. The most precious gift we can offer others is our presence. It's from Thich Nhat Hanh, when mindfulness embraces those we love, they will bloom like flowers. And I think that is so important because this is really the essence of what today's focus is. How do we give the gift of our presence to everybody that we encounter and that we have to especially engage with online? And the article that we are looking at today is by S. Galler, and like I said, it was published in 2020, Cultivating Online Therapeutic Presence. Just a little bit about her. She is a clinical psychologist, an author, and a mindfulness self-compassion teacher, and she's on the teaching faculty at York University and the University of Toronto. And along with a range of publications, she has also authored 2 books, Therapeutic Presence, A Mindful Approach to Effective Therapy, that was co-authored with Leslie Greenberg, and A Practical Guide to Cultivating Therapeutic Presence. So to start off, how has COVID-19 impacted us? And I think a lot of different therapeutic practices had to shift online. And from in-person, face-to-face contact, it had to move to virtual contact. And for many of us, it happened with limited online experience. Like Mo indicated, especially for the group of us, the born before technology, the BBTs, and a lot of us found ourselves in gray area, in unknown territory, and we didn't know how to navigate this. And we even have less experience in developing therapeutic relationships online. So that was quite difficult because what we used to is on-site, face-to-face. We see the person sitting in the same room in front of us, and it became very difficult to navigate the new territory. So traditionally, psychological and emotional safety in the therapeutic relationship is generated by the therapist and the client. Like I said, sitting together in one room in the safe space, soundproof, normally private and secure. And we know that is how we foster therapeutic alliance. And it's more consistent in terms of how do we then actually get to therapeutic change? How do we achieve the shifts for our clients? And it's really reliable on this relationship that we establish. And the concern started, what are we going to do now that we are shifting online, now that we have this virtual contact? So the factors that contribute to strong therapeutic relationship and positive alliance has been therapeutic presence and foundational training in how we create a presence, how to be with clients is fundamental. It's the first thing that we all get taught in our training, how to stay grounded and attuned within ourselves, because that is key to how do we then attune and tune into our clients and what they present with. So although this is, a very simple stance, learning about how to be with clients, it's also very complex. And it requires commitment to our own self-growth and relational skill building. And it's an ongoing process. It's not a once-off. So with the additional challenge that we now have of conducting therapy online, there are unique features that we need to look at how do we strengthen this relationship, because it's not the same as sitting in the room with a client. So we have to look at what are the challenges of online presence, what is in the actual setting that we create, because clients might be in their home environments, especially initially when we had lockdown, and they are with the very people that they have issues with. And also they become distracted in the online environment. How many of you are not currently, multitasking, looking at a WhatsApp message, looking or answering an email? And that is what our clients do, because we do become distracted in the online environment. But therapists having technological challenges, and they report feeling more tired, experiencing Zoom fatigue, Teams fatigue, online fatigue, and therapists starting to doubt themselves, and they start losing confidence through this new way of working. And many therapists also had to cope with their own issues and concerns around loss and grief, and their personal anxiety around COVID-19. And that has been some of the challenges that people have experienced online. So this article really focuses on what the therapeutic presence is, how it contributes to developing a strong therapeutic alliance, and what are the unique challenges of therapists in cultivating presence online. And then just some tips on how to cultivate presence online. Okay, so first of all, what is therapeutic presence? And this picture was taken from Shelley Galler's book on therapeutic alliance. And it's really a way of being with a client that optimizes the doing, the therapy in the moment, and the technique of therapy. So it's how do you present yourself in that setting with the client. It involves the therapist bringing their whole self to the encounter with clients and being fully in the moment on a multitude of levels. Physically, emotionally, cognitively, relationally, spiritually. We all know how exhaustive it is to have therapy sessions, and especially back-to-back therapy sessions. And it's because of this, because the therapist brings themselves as the tool to the client in that setting and to multiple clients on a daily basis. Therapeutic presence helps therapists to attune to their own moment-to-moment experience, as well as the experience of their clients. So it's about being aware of where you are at, what you are experiencing, what emotions you as a therapist are going through, and at the same time, what are the emotions and feelings and thoughts and challenges that the client is presenting with. The therapist's presence involves being grounded in one's own self, while receptively taking in the client's verbal and non-verbal experience. And that's really what I spoke about. Being aware and grounded in yourself, but looking at the cues. What are the verbal cues that they're giving you? What are the non-verbal cues? And being responsive to pick up on that. It's about embodying and relating to the client with presence. Also help the therapist to stay grounded. So while you're doing that, while you're relating, it helps you to ground yourself amidst all the difficult emotions that are being poured out. It provides an invitation to clients to feel felt, to feel met, that my emotions are met, my needs are being met, to be understood, having that sense of this person gets me, she knows what I'm talking about, he is realizing what I'm going through. And clients to feel inviting a sense of safety and optimal engagement in the work of therapy. So that is really the essence of therapeutic presence. And as we can see, it's more than just one simple thing. It's the awareness of self while engaging in the therapeutic process. Therapeutic presence is a common factor. So we see that it's not just, supposed to be there for one specific therapy model or modality. It is really a common factor across a range of different therapeutic modalities. So it can be viewed as trans-theoretical, or basically the common factor, but it's valuable and it's recognized across various psychotherapeutic approaches. Psychoanalysts recognizes the importance of therapeutic presence, being attentive, listening to your client, having the third ear, that's what they call it. Psychodynamic approaches, being in the present moment in that therapeutic relationship and being open and authentic. Client-centered therapists, we all know Carl Rogers as the person of the client-centered approach. And for him, the therapeutic presence is an underlying condition to empathy. So we need therapeutic presence in order to actually relay empathy and unconditional regard and to be congruent in our responses. And he felt that it's very necessary for empathy to be felt and expressed. Existential and Gestalt perspective says that it's a key concept for both focusing on the here and the now contact and awareness. And for emotionally focused therapy, they also say it's an essential stance to support and strengthen the therapeutic relationship. And then cognitive behavior therapy, a lot of us might be surprised that, but it's so important to have therapeutic presence. And, you know, CBT recently started to highlight the role of presence. And a range of different studies are now suggesting that presence can be a significant clinical stance in CBT, as presence and attunement to the client in the moment can optimize the timing and the effectiveness of therapeutic techniques. So really, it allows you to time when to do certain interventions for the client. Are they ready for it? How will they receive it? So we see CBT, emotion-focused therapy, and person-centered therapies. Research has shown that clients are rating therapists as present. They're more likely to do that if they have therapeutic alliance. And then even in our mindfulness and self-compassion approaches, we see that the recommendation is that therapists have a personal practice of their own mindfulness techniques and self-compassion. To be kind to yourself and to be compassionate to yourself, that cultivates a therapeutic presence. Okay, so how does that work? Okay. So if we look at the Polyvagal Theory, it helps to explain the mechanisms of change that presence really evokes. And according to this theory, our nervous system are constantly in a bi-directional communication with other people's nervous systems. So it says then, if the therapist is fully attuned and in the moment and aware of what is happening, they're there for their clients, they're able to mimic and see what is happening. So their receptive and safe presence sends a neuropsychological message to the client that they are being heard, that their needs are being met, they are being felt, and they are being understood. And that is really, like I said, it's bi-directional. It is about being attuned to yourself and creating that safe environment. And this process, this bi-directional process, elicits an approach and an experience of safety between the therapist and the client. And once that happens, that facilitates social engagement. So it then lessens the feeling of unsafe. This is not a good space for me. The person doesn't understand what I'm going through, and they don't experience the fight or flight response, but really goes into a moment of I can be open, I can be honest, I can be in the present moment, I am grounded, I'm mindful about what is happening, and I can share what difficulty I am experiencing. So that's one way of understanding how therapeutic presence helps to create safety. But there's also the term that was coined by Daniel Siegel called the window of tolerance. The sense of mutual safety and the strong alliance also invites clients to be in the window of tolerance. And that is really the same as what we have described previously with the Polyvagal Theory. So if the client is not hyper-aroused, the client is not hypo-aroused, where they feel they cannot talk, they cannot share, they, sort of withdrawn, and they feel like they're not making a connection. So the therapeutic allows this window of tolerance where arousal levels are so regulated that emotions are activated and the person feels safe and they start to share. And even people that have been very overwhelmed with traumatic experiences experience this therapeutic presence, they experience the safety, and that allows them to actually open up and be honest in the process. Further also, how does therapeutic presence help to create? And it's really about right brain to right brain communication and the verbal communication. So it's about body posture, it's about vocal expression, it's about our facial expressions, it's about our gestures. And I'm just aware of the fact that I'm gesturing as well. So it's about how do we then mimic what is happening in the session so that the person feels met and understood. And their brain perceives it as a safe space, and they liken it, it's established as a neuroception of safety. So again, the person does not have a sense of, I'm going to fight, I'm going to flee, I need to get out of this, or freeze and draw in to themselves, but again, having social engagement. There are also interpersonal aspects to the mechanisms of change, and therapists use themselves, like I said previously, and they attune bodily, they become aware of what is happening, and they like an antenna, reaching out and becoming aware of their client and what the client needs. So yes, if we look at that little infographic, the phone rings and the person says, "Mom," and "Oh dear, you need me to return something humiliating for you." "No, wait, you need me to buy something humiliating for you." "No, wait, you need me to pick up humiliating before diet pictures that were accidentally printed by the photo store." And all she said, but Dad says, all she said was, "Mom." You have to be a native to understand all the translations. And I think that's where we all find ourselves, with online therapy and missing some of the cues. And some of us have actually become quite good at it. We've become quite good at picking up on certain cues. And we now know where our strengths and where our weaknesses are in terms of this. But it is really about the therapeutic presence in online is again, the body-to-body nonverbal cues that we use, including, they call it the prosodic vocal tone, and it's about tone, it's about pitch, it's about how do we mimic, our client as well. And that has become quite important. So in online therapy, therapists have a reduced ability to express their presence with their full body. And we all know that we use our body, to actually mimic gestures, but to also ensure that the person sees that this is a receptive and safe space. Okay, and then the challenge of therapeutic, of therapeutic presence in teletherapy, countertransference. How do we deal with countertransference? Enough already, you're depressing me. So, it increases actually the likelihood of a therapist countertransference. Clients express increased anxiety, trauma, and fear in relation to the pandemic, along with their ongoing long-standing issues and underlying pain. And therapists going through their own anxiety and grief and fear, in relation to the panic, can actually be activated by clients' shared distress, eliciting countertransference issues and interfering with the ability to be fully present and responsive to their clients' fears. And I think that's something that we all need to be aware of, about the transference and the countertransference in the room, and especially when we do online therapy. And because of our increased fatigue, because we are doing this so often and for so long, a lot of therapists are complaining about being extremely fatigued, much more so even if they had a full day previously of seeing face-to-face clients. The Zoom fatigue that sets in is actually worse because of everything that people have to be aware of, and how they try and create that therapeutic alliance and positive alliance, especially with new clients. It's much more easy to transition when it is an older client or an established relationship. And then some of the big challenges has been the technological challenges. We all know everything is about the Internet of Things these days, and we all had to learn how to deal with it. But technological challenges and glitches do set in, and that can set in so often. And also our lack of training in engaging in online therapy has been extremely difficult. And sometimes clients attribute the glitches to the therapist and to the therapist's, lack of presence. And we need to be so wary of that, because especially if we are anxious about being late, or we have a glitch and we don't log on time, all of that anxiety can easily spill over into the session. And we need to catch ourselves and realize, what is it that I'm doing, and how is that affecting establishing the alliance and therapeutic presence. Research shows that therapists are more likely to use the technology and strengthen therapeutic relationships when they are trained and supported on how to use telepsychology in their practice. And we also know that another challenge has been that clients are in their homes, like we've mentioned previously. They may be in their home environments with family and others, and with the people that are actually causing the anxiety or the challenge that they're talking about. And the anxiety about how do I now verbalize what I'm going through without the person hearing. So finding ways for therapists to express presence so that clients can sense and feel their presence is critical. And helping the client to find a safe place within the home to express their emotional experience is important. And it will be important to guide the person on how to actually request from family members that they need, a confidential space and private space where they can speak openly. Can therapeutic presence and the therapeutic relationship be effective? So yes, research has shown us that teletherapy is effective in working with clients with a variety of disorders, and clients can both benefit from online therapy and develop a positive working alliance. So yes, it is definitely positive, possible to develop that. Therapists tend to have a negative view. Some therapists tend to have a negative view towards teletherapy and the possibilities of developing positive alliance. And it's been found that it's especially for those of us who've never done it before, which is the majority of therapists. We've all been, with the conservative way of the conservative, normal, usual way of just being in the therapy room. So there's been a lot of challenges with just bridging our views around how do we connect and do online teletherapy. And it can really impact how the therapists then rate the alliance in online therapy, and may even affect how they approach online therapy. And it's stated that the bias could be based on limited resources, limited literature that there is currently on online therapy, limited training, limited experience, because we're all learning on a daily basis how to navigate this unknown territory. So the pandemic forced many therapists who have been reluctant previously to offer virtual therapy to now actually doing that 100%, for all of their clients, and actually refusing to do face-to-face because of the anxiety that is still there around the pandemic and contracting COVID-19 illness. And shifting their bias from face-to-face to online has become imperative for all of us. All of us had to learn how to do that. And as we know, COVID-19 has not disappeared. So the need for this may remain for several more months and even years, where we have to do this. And it has been predicted that we might even go beyond the pandemic, where people just continue with virtual interactions with clients. So it's definitely something that can be effective. So studies has shown that clients favor face-to-face therapy over online therapy. But literature reviews suggest that clients generally do not have a preference between in-person or online. So there is still ambivalence around this as well. Okay, but it has been proven that it's good for rural communities and for various populations. It's also time and cost efficient. And that's why a lot of people are starting to move there. But like I stated, there has been limited research on this. And there's one study that was conducted with nurses, and nursing literature now offers some examples where presence can be felt by nurses in the nurse-patient interaction, in telehealth interactions, which gives a suggestion that presence can be transferred online. We also know that in countries like in the UK, they have telenursing. So you would call in and explain the symptoms to a nurse through a telephone conversation, and that has been proven to be quite effective. And that happens before referral to a medical doctor. So basically, as a screening, initial screening method, that was what it was intended for. But it's actually evolved, and it's found that clients interact with nurses telephonically in a similar way that they would, if it had been face-to-face. So there's limited research, but the research seems to point towards the fact that it is possible to establish therapeutic presence and positive alliance. Another study in 2016 suggests presence can be generated in online therapy if nurses are trained and accustomed to the equipment and the technology. So like you can see, studies has really just been done on the nursing population, and there's a need to start doing more research, finding out in other population, mental health professional groups, how therapeutic alliance has been established. Research with CBT for the treatment of panic disorder and agoraphobia in 2007 already demonstrated that in addition to empathy, warmth, and understanding and technique, clients are actually able to access a sense of presence with a therapist if it's done online. So although it's a study that was done a while ago, there is some indication that, in CBT, this is possible. In 2019, Alvanti proposed 3 modules for counseling presence online. And he looked at cognitive presence, he looked at counseling presence, and he looks at emotional presence. And he says that cognitive presence includes the ability to empathize with clients. Counseling presence reflects the expression of qualities of presence, such as listening, trust, compassion, to ensure that the client feels heard and understood. And those are common techniques that we use, sometimes without even thinking. Emotional presence reflects feeling emotions with the client and helping the client to express and manage their emotions. And if those 3 models of presence is actually exercised, the clients report that they are feeling the therapeutic presence. But one common concern is missing nonverbal cues. And that can actually negatively impact therapists and their expressed presence. So missing perhaps on the expression of facial cues, of gestures, of tone, and some therapists find it difficult. And we'll see with the tips, it depends also on the lighting and the ability to see the client, the ability to make that connection. How far are the person from the camera and the screen? How far is the therapist from the screen and the camera, and are you able to make that connection? So now we're getting to some of the tips for cultivating therapeutic presence. First and most important, online safety and security. I think it's very important that both therapist and client feels that the platform that is being used is a safe platform. It's a platform that allows for a level of encryption and safety for both parties. So I think that is the one important thing, that before you start out, both therapists first of all needs to know that the equipment and the tools and the software is rated or has a level of encryption, and to communicate that with the client so that they feel that it's safe for them to use it. Consistency in setup is very important. Set up a place in your home or in your office where you can see your clients consistently, and that mirrors your therapy room. So I think it's important that they have a sense of, this is now our virtual therapy room, and what does this look like? And to be consistent. Some therapists try to change the screen, the background screen, and some clients actually find that it creates anxiety because they don't have that consistency in what it looks like. So I think it's important to try and recreate and have the same space. If you move rooms, to try and somehow mimic that it looks similar, because it allows for a predictable environment for the client, and it helps with feeling safe and being able to just express themselves comfortably. Sometimes it's important to consider using a larger screen. I think, if you work in private practice, it might be something that is more feasible than for anybody that works in a corporate or work environment where we rely on the tools that we have. But if it's possible, to have bigger screens where the client can see more than just the face, it does help to create safety. Ensure privacy and remind your client to ensure their own privacy by asking family members or people who share the home to be in a different room, and if it's possible with headphones on, just to have that privacy and confidentiality, because that does impact on the ability of the client to actually share. We spoke about optimal distance, and finding a safe distance between you and the screen, not too close that it feels invasive, not too far away that it makes you look distant and small, and that, it's impossible to breach that distance. Because especially with lockdown, everybody's already struggling with physical distancing, social distancing, and even more so for the therapist and the client. It might feel like we are so physically distant, but we're also socially distant from each other. So it's important to create that space that feels right for both of you. So, you could start by asking your client, to assist you. Does it feel too close? Does it feel too far? Is it just right for them? And also to maintain your eye level and eye contact. And it's important to ask them, does it feel like I'm making eye contact with you, or does it feel like I'm looking past you? And to create that alignment where the client feels that you're actually looking at them. We spoke about lighting as well. It's so important to have the right lighting that's optimal, not too bright, but also not too dark. You don't want reflections if it's too bright, and you don't want the darkness that you can't see the client. So it's going to be important for the client themselves to actually, be in a space where you're able to see them. And professional dress, I think that is it's a given, but dress as you would in the office as well. That creates that sense of safety for the client as well. It may be tempting to stay in comfortable bottoms, assuming that your clients cannot see your pants. But be careful about the anxiety that you feel around that, and how that might, the counter transference that might happen in the room with the client. This is a busy slide with a lot of writing on, but I think it was important just to put down all of these as well. How do you optimize your client's presence? So ensure that they have a private environment where they won't be disturbed, because that can affect what is shared and how it's shared, and whether there is a sense of safety. But also empower your clients on how to speak to members of their home to ask for what they need and how they need for this to happen. Invite your clients to intentionally minimize distractions. Turn off their phone, turn off any background apps, so that they don't receive any emails while they're engaged. No text alerts, no messages coming through, no people knocking on doors. And we know even in our offices how often that happens, and how big of a distraction it can actually be. Because as you're trying not to hear that, you might actually be missing out on what the client has just said and how they might be perceiving that. Ask them to keep their camera on, and I think that's a very important one that I've bolded there, because it's important for you to read any cues that they might be giving you, but it also assures confidentiality, so that you know that there are not any other people present when this is happening, when the session is being conducted. Very simple tip, but so important. Remind them to have Kleenex or tissues there, and it's so important because you might find that we tend to take for granted the fact that the box of tissues is always ready. It's handy. The client can just reach out and actually get it. In this case, not as much. So it's important that they actually have tissues if need be. Invite them to prepare emotion regulation tools if that's something that they need, if that's something that you use. Some clients need a weighted blanket, especially clients that is dealing with a lot of traumatic challenges, or clients that experience a multitude of traumatic events in their lives. A lot of them find comfort with a weighting blanket when they have to speak through that, and it's important to prepare ahead for those clients. Some therapists use ice. Some therapists use sensory balls for emotion regulatory clients, and so it's important to prepare the space beforehand. If you are engaging in therapeutic work that involves props, such as in Gestalt therapy, where you might be using the empty chair technique, it's important then also to prepare those before the session, so that the client would then have the empty chair with them in the room while you engage with a virtual therapeutic session. CBT therapists can ask of their clients to have their thought records available. Dialectical behavior therapy therapists can remind their clients to bring their diary cards or the emotional regulation tools, like I've mentioned. And help your clients to determine what they need in order to transition gently after the session. And what that entails is really, how do I go from ending the therapy to back into my room? And that is so important, because when we have therapy face to face at the at work, or at your therapy rooms, the client gets back into their car and they use that space to actually transition from therapy, from having shared, from having dealt with a lot of difficult emotions, to getting them to feel in control again. So it's important when you're doing virtual therapy that they have enough time to do that. So they don't have the time, like stay there in the waiting room or to travel home as they usually would have had. So, share with them, give them techniques, maybe just spending a couple of minutes extra in the room before they exit and go and be with their family. And then also provide written guidelines or tip sheets, about the preparation that they need to do in advance to the sessions. And how to optimize their ability to create their own safety in supportive space. So just some general tips for how they can then optimize their own therapeutic presence. What to do on the day of therapy or prior to the day of therapy, prepare yourself for this as well. Take a walk, do something physically to shift from your virtual office, as you would. And normally we would also do that. We would walk to the therapy room and prepare ourselves ahead of time. So don't just sit in one room and have back-to-back sessions. It's important to transition between virtual sessions as well. Take 5 to 10 minutes to center yourself to help activate your own embodied presence. Take some mindful breaths, or do some yoga techniques just before to prepare yourself to go into it. And intentionally invite the client into the virtual room once you have prepared yourself. So have a set routine of how clients would enter. Are they waiting in a waiting room for you then to let them in? And do you talk also on that point? You talk about not sharing the links, creating privacy around the emails and the links that you share them. And that's another thing for clients to feel safe. Allow time for self-care outside of the sessions, and that is so important for you as a therapist. Self-care and cultivating presence outside of the therapy room is part of the model of therapeutic presence. Where am I at? Am I doing okay? Do I need a break? What type of break is it that I require for myself? An increase in this kind of self-care is even more prominently needed now during the pandemic than even before. We all know that we have to self-care, but more so now than ever before. And during the session, discuss openly any feelings or concerns that you or clients might be having in this new virtual space, because that might be impeding the therapeutic process and their ability to share. Communicating presence, empathy, and resonance. So look at your facial expression, the prosody of voice, which is your rhythm, your timbre, your volume, your pace, the tone, the speed, eye gaze. We spoke about that, being able to have that where it feels like the client is seeing you, nonverbal cues, the gestures. So how do you communicate that through all of these nonverbal cues? Stay attuned to your own experience as you connect with clients. This includes attention to your own affect tolerance and verbal and nonverbal cues, as well as the distractions that might be happening that might be creating anxiety within you. Be aware of that it's probably not the therapy session that's creating that, but distracting sounds and noises that might be coming from outside. Maintain mutual eye care. That comes up again and again, which is very important. Ask your client if their eye gaze is in contact with them, and how to actually create that. Invite synchronicity. Allow yourself to co-regulate with clients by mirroring their expressions, eye gaze, vocal tone, and pace. Once again, very important, and this comes up again and again. Stay aware of matching the eye gaze of your clients. Receptivity, while starting the session with an open and centered place within yourself, continue through the session to let go of any distractions or fixations on a certain insight in order to be present, open, and receptive. Sometimes we find that even with virtual therapy, it seems like we want things to go faster, like we're more impatient, we're less patient with our clients. And it's important to actually let go of distractions and fixation on certain insights that we want them to gain. We're almost done with this. So just attuning to yourself, we spoke about it also. Stay in contact with your own body and emotional state in a very compassionate way. Have some self-compassion for yourself, be kind to yourself, recognize what is going on, recognize important states such as emotional resonance with clients' experiences, just being aware of what is happening for you, and tracking your clients' responses. Notice the slight nuances that might be happening in their micro expressions, and that is where it's important to really create a space where they feel that their needs are being met, where they are being heard, when they are being felt. It's so important to get the client to get to that window of tolerance where they're able to socially engage and they don't feel overwhelmed or shut down. Yes, I think lastly, just contact. Keep confirming. Look at your thumbnail that appears. I know with Microsoft Teams, sometimes, no, that's only when you do a presentation, but it's important to keep looking at your image as well to confirm that you are still making contact, that you are still aware of what the expressions might be that is on your face, almost like a mirror back to yourself. So pay attention to your responses as they are reflective of the client's in the moment experience and the larger therapy goals, and check in with clients ongoingly about your distance and whether you or they need to adjust to allow for optimal feeling of safety. And that is very important, that to and through making sure that everybody is feeling safe. Manage your counter-transference and the challenges that might present itself, like we spoke about. Everybody, we included as therapists, are experiencing a lot of anxiety. We might be feeling depressed. We might be going through loss and grief. We might be depressed just about staying indoors all the time. So it's important to manage your transference and the challenges that brings. At the end of the day, closing of the session, determine if you need more time than usual between sessions to also transition. Just like the client needs to transition from the session into the home environment, it's important for you to also transition at the end of the day. Use that time to take notes, use it as your administrative time, regroup, do some physical stretching and moving around, and at the end of the day, intentionally close your laptop, close wherever you have been, close that door so that you know that you're leaving the therapy space and you're now going into your living space. And that transition physically from one space to another is quite important. And before engaging in your home life, ensure that you take care of yourself as well. So in conclusion, online therapy is here to stay, and that is what this article is showing us. And therapists would benefit from really understanding further how to cultivate therapeutic presence and effective therapeutic relationships online. This modality will likely continue to grow long after the pandemic is over. I foresee that a lot of us will continue doing virtual sessions, and a lot of clients who are now becoming more and more comfortable will request virtual online sessions. The utilization of online therapy may have a greater appeal to therapists and clients after now having had the experience with it. Hence a focus on actively, intentionally cultivating therapeutic presence online in order to build and strengthen relationships is going to be essential. We have to learn how to do that. We have to train ourselves. We have to be aware of what is happening in the sessions, even more so than in face-to-face sessions. This would help the client to feel emotionally and psychologically safe with a therapist, even from a physical distance, knowing that my therapist is still able to make that connection with me. So the ability to generate presence and cultivate positive therapeutic relationships is an important topic that this current pandemic is inviting us to learn more about. So this really ends off the discussion about this journal article and how to cultivate therapeutic presence. And I hope I've shared, some of the tips and perhaps some of the things that you might be able to use yourself. So I don't know if there are any questions or comments that might have come up in the chat.
Thank you so much, Liesl, for that very insightful presentation. Ladies and gentlemen, I see there aren't any questions in the Q&A section. Perhaps you'd like to raise your hand and we can invite you to pose your question. Let's engage. We still have a couple of minutes. So let's use the time.
I also just want to remind everybody to please let us have your names that you would like on the CPD certificate, as well as your professional registration number and your email address, so that we can forward the CPD certificate to you. So please, in the chat, please write that down for us. There is somebody that is also a Zoom user. Would you be able to share your name with us, or to change the name from Zoom user to a name that we would be able to recognize, so that we can send you your the certificate as well? And there's somebody that is the name is Please Rename.
Yes, please.
So if we can have that, it will just make it so much easier for us to be able to send through the certificate, so that we don't have to figure out who logged on. So please, the two attendees, Zoom user and Please Rename, kindly just change it to your names.
Mr. Muela, I think you need to leave your details in the chat section, unless you're posing a question to us.
As well as your registration number and your email address where you would like to receive your CPD certificate. Any questions or even comments? How have you who are doing online therapy or dealing with clients receiving online therapy, any comments on how they have been receiving that, or any challenges that they might be having, or any challenges that you might be having, or good practice that you could help all of us with?
Liesl, so I've got a question or comment here from a Dr. Nandi Pakasha.
Yes.
She's saying, I'm working from home as we speak, had to connect with my stakeholders virtually on a daily basis. It's a roller coaster, I must say. Thank you for sharing.
Thank you so much. It's definitely a roller coaster. It's like a never-ending roller coaster. We're going up and down, and it feels like it's just not stopping. But I think it's about the self-care that we spoke about. So it's about taking the time to really tune into yourself. Look at what are the challenges that you're experiencing, and what are the things that you need to just regroup. Mo, I think somebody raised their hand.
Okay, let me have a look. Okay, Oacheng, I'm going to give you the floor to pose your question. You can unmute.
Thank you, Mo. And I think this was really enlightening. From my side, I think maybe I'm too old school also, but we are all new to this. But I find it very, very impersonal, especially having to go through counseling with somebody online, whether the video, the camera is on or not, it's really limiting for me. And I must say, the information that you've shared will go a long way really in assisting to really get used to it. But honestly, it's really difficult.
Thank
Thanks.
you. Yes, thank you so much for sharing that. And I think it is an emotion that a lot of us share that we wouldn't always be so honest about. It's scary, it's frightening to start this, and we all make so many mistakes, along the way. But I think it's important to realize that, the more we do it, the easier it will hopefully get for all of us. But it is a difficult, I acknowledge. It's not an easy process, but it's unfortunately a necessary process because we need to be able to assist and help.
Thank you, Liesel. And we've got a question from Mr. Stemba Mwate, and he's asking, have you ever had a client breakdown that is crying during a session, and how did you or would you handle the situation?
Yes, it has definitely happened. A lot of times I think that is when the client is really feeling the therapeutic presence. They feel comfortable enough to share their emotion. And sometimes they are just so overwhelmed that that's the only response that they have. I think as a therapist, your initial reaction is feeling helpless because you're not there in the moment. But it is about actually conveying that. What I've done the first time that it's happened is to actually say, we are not together, but I do see you, and I see the pain that you are experiencing. And I think that is all that clients want and need. We spoke about, they want to feel that they are being met, in their emotion. They want to feel that they are understood. They want to feel that you are connecting with them, that you are understanding what they're going through. And I think it's just when we are unable to have the non-verbal, in the session where we would either reach out or just sit and acknowledge, we can still provide that holding space. So this is just a different holding space. And I think clients feel held when they actually allow the emotion to flow. So I think we shouldn't be scared. We should just, try and be there for the client.
Thank you. Thank you, Liesel, for those responses. I just want to say a few comments, response with regards to the details that have been sent. Please don't forget to send us your email addresses as well, so that we are able to communicate with you, specifically Tami Mudisane. Thank you for your details. Please include your email address there.
I think, Mo, just to check if there are any comments that might have come through on the Facebook Live, perhaps, or YouTube.
Okay. Nobisa, would you be so kind to please check for us that side?
I think Dr. Nandipa, was that the one that we answered?
Yes. Yes,
okay.
Yes, that's the one.
All right. Any others, Nwabisa?
No, not at this point, Lisa.
Okay. Any other comments, from the attendees? Perhaps just sharing how you are experiencing it. We have about 3 more minutes left. I think it's been, it's one of those things that it's new to all of us. It's something that we really have to practice. The saying goes, practice makes perfect. But I hope that the tips that was given, in this article has assisted some of you. And please engage with us. Let's have a discussion, further discussions as EAP practitioners and wellness service providers in terms of how do we bridge the challenges? How do we make it easier for ourselves? And thank you for all of the comments that have come through. Like I've mentioned, we have 7 more of these. We will share with you, I think next week, Friday, we have another one coming up. The times will be consistently the same from 2 until 3:30 if there are more comments and questions that there might be. But we will share all of this. Please share with, your colleagues in your different departments and organizations so that we can have, more people be able to engage as well. Amanda is saying it's a bit challenging in our department, as connectivity and virtual tools might be a challenge from the client side. Yes, some clients might be experiencing that, but if people are able to connect, because they will be able to earn free CPD points, it might be worthwhile to try and see how they can do that.
Yeah, Liesl, I think from Amanda's comment, it's would be more related to the virtual therapy, the challenges experienced with connectivity and virtual tools.
Yes.
Yeah. Okay, so I think we can close off. I don't have any questions in the Q&A section. And the chat section as well, everyone has commented with their details. So we can close off.
Thank you, everybody. Thank you so much for attending and staying, right until the end. It's really, we appreciate that. We will share with you the detail of the others and look forward to see you on the next Virtual Journal Club. You are all now part of the PHS Virtual Journal Club. So welcome. Thank you so much for joining us.
Thank you, everyone, and have a wonderful afternoon.